chatting earlier about 10% of patients, fewer than 10% of patients in England who are eligible for the weight loss drug Mounjaro will be able to access it on the NHS during the next 3 years. Thomas is with us. Why is this, Thomas? Good morning.
Look, it seems like this drug is too powerful for the NHS to handle. Mounjaro helps people lose around 20% of their body weight over a year. And now the National Institute for Health and Care Excellence has said that 3.4 million people would benefit from it. But the NHS kicked back when draft guidelines came back earlier in the year and said, in fact, they would be overwhelmed if everybody went to the GP wanting access. So only 220,000 people are going to get it in the first 3 years. The others will have to wait for up to 12 years, an extraordinarily long time if you are living with obesity, suffering from all the consequences. But the NHS has said that it just can't cope. And this was the Chief Medical Officer for NICE speaking to us earlier on.
It's impossible to implement such a massive service change very quickly in the NHS, particularly considering the pressure that NHS services are under at the present time. And so NHS England have applied to NICE to delay the initial start from 3 to 6 months and then to extend the implementation period. Now, the first step of that will be a 3-year period during which those with the greatest clinical need will be prioritised and they will receive this medicine with that support that I've described.
So first, this drug will be available to people who are in hospital weight loss clinics waiting for treatment from March. Then from June, it should be available through GPs. But the NHS is still trying to figure out how that could be delivered alongside diet and exercise that is essential to helping people to lose weight safely, to make sure that they can go and live in the long term at a new balanced body weight. So this is a real challenge for the NHS, these new drugs, alongside Wegovy, of course, which has been used for around a year or so on the health service. But it's really not coping well on how to roll it out, given that 1 in 4 of us is living with obesity.